Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 191,732 confirmed cases of COVID-19 in Canada and 62,196 cases in Ontario. Chatham-Kent has 371 cases.
Unmuted.
And Sarnia-Lambton has reported 358 cases. Michigan now has 141,091 cases, with 14,828 cases being in Detroit. Today, we are reporting 2,757 cases of COVID-19 since March, an increase of 13 cases from yesterday. Of the 13 new cases, 6 are close contacts of confirmed cases, 2 are local healthcare workers, 1 is community acquired, 1 is travel related to the US, and 3 are still being investigated. 2,613 cases are now resolved, and 68 cases are active and being followed by our health unit. 2 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. 1 long-term care home is currently experiencing a COVID-19 outbreak, and 3 workplaces are in outbreak, including 1 in the agri-farm sector, 1 workplace in construction, and 1 in the food and beverage industry. With Halloween quickly approaching, we would like to focus on the importance of public health measures to prevent the spread of COVID-19. Stay home if you are not feeling well. Limit your number of contacts. Keep 2 meters distance from others. Wash your hands before, during, and after any activity, or use an alcohol-based hand sanitizer. Wear a mask or face covering. The Health Unit is recommending low-risk activities this year to help reduce your risk of COVID-19 and limit potential transmission. Individuals that are at a high risk for COVID-19, such as seniors, those over 70 years old, and individuals that are immune compromised or have a chronic health condition should only engage in low-risk activities this Halloween. Low-risk activities include celebrating at home with your immediate family and being creative with your activities, such as a trick-or-treat scavenger hunt or hosting a virtual costume party with family and friends. Parties and traditional trick-or-treating increases the number of contacts and potential for exposure to COVID-19, making these high-risk activities. The WICHU recommends that everyone avoid activities that put them at greater risk of exposure to COVID-19. If you are considering high-risk activities, follow these recommendations for a safer Halloween. Trick-or-treat from a distance. Wear a proper mask or face covering. Costume masks are not suitable. Practice frequent hand washing. Avoid touching surfaces. Avoid large groups. Limit the number of households you visit. Not everyone will feel comfortable with participating in Halloween activities this year, and that's okay. Let's give people permission to not participate and not judge. If you are considering handing out treats, keep these tips in mind. Have a pump hand sanitizer available for kids that may need it. With the parents' permission, you could offer it to reinforce proper hand hygiene. Distribute treats from a distance using tongs or a table with spaced out treats. Provide treats that are prepackaged and individually wrapped. Wear a mask or face covering at all times. Place physical distancing markers on your driveway. And consider sitting outside to avoid large lineups and congestion at your door. All of these tips will be shared in our media release so parents and children can have a safe Halloween keeping public health measures in mind. Please continue to visit our website at wechu.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us today. As you're aware that we have put a lot of data on our website, which is interactive, and people can choose how they like to see those information. And that information is constantly updated as we are trying to put all of the information that we present on our epi summary on our website. Today, I would like to cover some of the epi data that we are seeing in our region, some key highlights. I will not go through all of the slides, but we'll try to focus on some of the key trends that we are observing, which is in addition to what is currently available on our website. So very quickly, this is what we will cover. And as we know, always interested in looking at the epi curve by what's happening in the community. And epi curve give us a good understanding of the number of cases that are reported to us every day. And if in this particular graph, what you're looking at is epi curve date by agri-farm status. And as you can see, that most of the cases we were seeing were in July and early part of August, and then a significant decline in the number of cases. And then we have seen some activity in the September and October month, mainly a result of travel when new workers are coming in, and during their quarantine period, they were identified as cases and they completed their isolation, never resulted in any outbreak. More recently, what we have seen is in one particular farm, which had one case and that resulted in spread of the case within the same bunkhouse, and that was managed, and hopefully those cases are resolving. There are no new cases that we are finding, so hopefully that farm will come out of the outbreak soon. Looking at the overall cumulative cases and deaths associated with COVID-19 in Windsor-Essex, this is what it looks like. And as we can see, that the new cases that are reported in our region has remained low in the past month, leading to a general stabilization of COVID-19 cases in Windsor-Essex. And the way to interpret this graph is to look at the steepness of the curve. Steep curves means too many cases in short period of time, and a flat curve means less cases over time. So what we are seeing is right now we're at the point where we're seeing more and more flattening of the curve in this particular graph. Another way to look at the data is to look at the 7-day moving average by reported date, and this particular graph is basically showing a 7-day moving average compared to the overall versus separating the agri-farm cases as well. So the blue line looks at all of our cases using a 7-day moving average. We see a peak in late March and April, and then the later is attributed to the outbreaks in long-term care home and retirement home. And more recently, what we are looking at we looked at in June and July a spike in the cases. But when we separated it from the agri-farm versus the community average, we have seen that most of the cases were attributed to the agri-farm, which is represented in the overall case counts in the blue line, and then the green line is just focused on the cases that are not attributed to the agri-farm. So right now, in the last month or so, we've seen that those two lines merge because there were practically very limited cases in the agri-farm, and we've seen some spike and some activity a few days ago when we reported a large number of cases in agri-farm, but otherwise generally we are well below the 10-day moving average for a long period of time. This slide captures the week-over-week incidence rate per 100,000 population from week 18th to our current week 42. We saw a dramatic increase in the cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector. We saw an increase in week 41, which we reported was as a result of the agri-farm sector. But overall, since week 32 to onwards, we have seen a steady trend with the weekly reported rates below or close to 10 per week, and more recently it's even closer to 5 per week or less, with just a spike in the previous week. Please note that week 42 is still ongoing, and it ends on Sunday. Comparing our weekly rates with the province as well as with the southwestern region, and as we can see, the blue line continues to indicate the trend in Windsor-Essex, which is a downward trend with a spike in week 41 and then continuing going downwards in the week 42. The Ontario weekly rates is seen in the yellow line, and as you can see, the Ontario rate continued to go up and seeing a significant increase in the number of cases. And as well as when we are looking at the southwestern region, our rates are pretty much comparable. We were very high, significantly high in the southwestern region, but now the cases are stabilizing, and some of the data from the last week is not available from southwestern Ontario, but generally speaking, it's very well aligned within the southwestern region. These figures look at all the tests and unique individuals tested by a week in Windsor-Essex. In total, 116,185 tests were completed, and out of these, 68,238 unique individuals were identified as of October 10th. Looking at all the tests, our current percent positivity is 1%, which is represented in the green line, and our cumulative percent positivity since the beginning of the pandemic is 2.5%. In the last 4 to 5 weeks, our percent positivity is roughly around 1%, or sometimes it's even less than 1%. Last week, approximately 727 tests were completed daily, which is reflective of some of the changes that the provinces implemented as part of their the symptomatic testing only, and with the appointment-based testing at all the assessment centers. This graph looks at the percentage of test results, all test results that are available within 1 day and 2 days of getting tested using a 7-day average. Recently, from September 10th onward, we saw a sharp decline in the 1-day turnaround time from the labs for test results. These are all for test results positive and negative both. More recently, we're seeing 80% of tests available within 2 days based on the 7-day moving average, but we'd like to see that number even increasing further and trying to get the results back in a much more timely manner. Focusing some of the data on the schools now, this graph looks at the school absenteeism data that is reported to the health unit, and when a school reports 10% or greater absenteeism, it is reported to public health. In recent days, we have seen a number of schools in Windsor-Essex reporting absenteeism, but that trend is now getting better with less number of daily absenteeism that is being reported to us. This figure looks at the number of students and staff that have been tested for COVID at our assessment centers. Since the beginning of school, approximately 385 tests were completed among staff and students. And again, similar trend that we can see. We have seen a spike in the late September, but now generally going down, and relatively stable number of people who are going to testing. Essentially, that means that most of these other individuals are asymptomatic and do not require testing, and that's why the need for testing is low in this age group at this time. So finally, looking at the regional and provincial rates, and that's one of the lists that we definitely don't want to be on top. We were on top of this provincial rates for quite some time. Our rates were high, but as we can see, that with more cases in Toronto and Peel, they are now the highest. They have the highest rate of COVID-19 cases per 100,000 population, and Windsor-Essex is currently placed at number 3. For us here, as we have mentioned in the past, our majority of the cases are coming from the long-term care home as well as the agricultural sector, and we're continuing to see to follow the trend, and hopefully our numbers will continue to be stable in our region. Looking at the age and sex distribution of cases, and this is what it looks like in the last 2 weeks. Overall, we have seen more male cases compared to females, and this is also reflected in the past 2 weeks. With slight variations are observed in the past 2 weeks, the distribution of cases is similar to what we have seen overall in the pandemic, with those the exception of the 60s to 69 years of age and those 80 years or older. So something what we want to focus on is the trend that we are noticing, especially in the 60 to 69 years age in this particular graph. As we can see, it is slightly increased from the overall average. So some activities there, which should be taken as a precaution and concern in the community, and older individuals, they need to be safe, they need to be follow all the public health measures, because we know individuals at those age group, they are at a higher risk of developing COVID-19 complication, and with the high cases in this group, this is something that we should be paying close attention to. Looking at the exposure data by reported date, this graph helps us to understand where all these cases are coming from. And as we can see, most of these cases here are in green. What green means that they are all close contacts. And from a public health containment perspective, it's always good to have all the close contacts as new cases, because then that means that we are all linking it appropriately, and we know where these cases are, and these cases are then isolated appropriately without spreading it further to other individuals. When we are seeing an increase in the number of cases in the community transmission, or the yellow graph, that yellow color that we are seeing in the graph, more of these community transmission means that there are more active cases that are not followed up, that nobody knows of, and that is contributing to the spread of the disease. So we have seen a good mix of all of those community transmission in the past and the close contacts, but generally speaking, most of the cases here, what we are noticing, are all close contacts in our region. We're still seeing some occasional travel-related cases, and as we have reported, not all of these travel-related cases are from people going to Michigan or people coming into the country as the temporary foreign workers. We're also noticing a trend in Canadians visiting other countries and then coming back after contracting COVID, whether for leisure reason or whether for visiting their family members outside of Canada. Looking at the COVID hospitalization and patients in the ICU on any given day, and this includes all the new patients as well as existing patient of COVID-19. Cases in the ICU have continued to remain low for a while. COVID cases, in the past 2 weeks, this number has been low to zero. The red line indicates the 7-day moving average in the ICU, showing a decrease to zero as well as in the last 7 days. Hospitalization have fluctuated more so than the ICU. While we have seen a surge in the cases in late August, we are now seeing a sharp decline in the number of cases currently hospitalized. So just focusing on the timeline between August to present, we've seen a large number of cases admitted in the hospital with COVID concerns in the month of August, but starting September, those cases are trending downwards, and further in October, those numbers are still much lower than what we have seen in the previous months. With respect to acute care bed capacity, we are below or within the 90% threshold, touching just barely there. And as we know, many of the hospital services are also resumed. That is something that the hospitals are watching, that we are watching, because any increase or surge in the number of COVID cases that requires hospitalization, it can impact the health system capacity in our region. Looking at the ICU bed capacity, which is slightly better than what we were seeing with the hospitalization, and as we can see, the threshold generally we use to keep it around 50%, but now as we can see, it's averaging between 60 and 70%, and more recently in the last week it's closer to 50%, which is good. So that means there is some capacity in the ICU, but we all know that it can change very quickly when more and more people get sick and require ICU beds. And this also, the ICUs are used for pre-op, post-op care for all the other community cases as well, not just for COVID. Looking at the ventilator bed capacity, what we can see is it's relatively stable, hovering around 20% of the mark. So that means we have some capacity in our healthcare system with respect to when it comes to ventilator, but also we know that it can change very quickly. So with respect to where we are right now, we can see that 95% of our cases are resolved and approximately 2.2% are currently self-isolating. And unfortunately, we lost roughly 3% of our cases to COVID. And among those who died as a result of COVID-19, what we can see is overall more female died with COVID diagnosis compared to male. And from an age distribution perspective, 66% of the deaths were in individuals who were 80 years and older. And the youngest person who died in our region was a man in his 20s. From a case fatality perspective, this is what it looks like in Windsor-Essex. Our rates were 2.8% case fatality rate, which is in comparison with the provincial average of 4.9%. And just focusing on just the long-term care home and retirement home, our case fatality rate was 15% compared to the provincial rate of 21.8%. And just in the community, our case fatality rate was 1%. So overall, in summary, Windsor-Essex is seeing low cases despite with some of the cases that we have seen in regions such as Toronto, Peel, and Ottawa, and now more recently in more recently in Hamilton and York region, all trending upwards, which is a concern for a public health community in general. So far, we are protected by it, and we really hope that all our measures that we have in place and the community following all those recommendations, we can keep the case counts low in our region. We definitely don't want to see a surge in the cases that we have seen in June and July, and overall we can manage our community better. The primary source of exposure continues to be a close contact with a confirmed case, which is good from a public health perspective, but it also points out to the fact that when you have more cases as a result of close contact, that means there are more interaction happening between people and in groups, and something that we are recommending that people should be mindful of their number of contacts and trying to limit the number of contacts they have. COVID-related hospitalization at this stage is relatively stable and in our region, with very few cases in hospital that are hospitalized and 0 to no cases in the ICU. Overall, acute care and ICU occupancy are within expected thresholds, but that can change very quickly. So I'll stop here and we'll take questions. Thank you.
Okay, we'll now take questions from the media. We'll start with Blackburn.
Good morning. I guess just looking at the hospitalization rates and the ICU rates, can you just correlate that basically to the fact that we're seeing the cases in the younger population now, and we're doing a better job of keeping it out of our long-term care homes, or what would you correlate that to?
Well, I think it's a bit of both. What we can see is from the case outcome perspective is we know that roughly 10% of the cases end up in hospitalization. And overall, when we're talking about how many active cases that are in the community, and then if we can extrapolate that from that, so whatever the number of active cases are, and the age distribution of all these cases, what would be the potential outcome? So yes, I agree that most of the cases are in the younger population, but we are seeing, as I noted, that there are some spike in the last 2 weeks between the 60 and 69 age group, something that we need to be mindful of. But overall, if any of them are sick, whether they are young or old, they will end up in hospitalization. But so far, the work in the long-term care home, proactive work that's happening through public health, through the hospitals, through the ministries, we're all trying to make sure that we are trying to keep our vulnerable population safe. And as I reported a couple of days earlier as well, that we are also working proactively with many of the farms in the region to make sure that they have all these preventative measures in place. So maybe that's one of the reasons that we are seeing low rates of cases related to COVID. But as a system in general, we are still up to like 90% of our capacity.
Any questions from the Windsor Star?
We got disconnected. We have to dial it again. We need the elevator music.
We all got disconnected there.
Yeah,
We
I think we're back now.
Half of
Okay.
Dr. Ahmed's question.
Okay, Maureen?
Did you hear your answer, or do you want me to repeat the answer?
No, I think I heard most of it. I did have one follow-up question, though. It looks like your live stream is also disconnected. Did you want to wait, or do you want to just keep going?
I'm looking at my team.
Okay, it seems back now. Okay.
Okay.
My second question was about the outbreak at the restaurant that you announced. at the beginning of the news conference. Was this one of the places that is on your exposure list already? Can you give us any other details on that?
Yes, so that is on our exposure list already.
Okay, thank you.
Is the Windsor Star on the line? Okay, CBC?
Hi, yes. Sorry, I think with just the confusion this morning, I kind of missed the new case breakdown. I hate to do this, but can Teresa maybe go over just that breakdown again for me?
So we do have 13 new cases and a change of 13 from yesterday. The total is 2,757. And of the 13 new cases, 6 are close contacts of confirmed cases, 2 are local healthcare workers, 1 is community acquired, 1 is travel related to the US, and 3 are still being investigated. And so right now we do have 68 active cases in our community.
Thanks so much. And then just another question. I know that there's been a nationwide push for people to get the flu shot, and Windsor-Essex, I believe, got that first batch at the start of the month. What has the uptake looked like, and how does it compare to years before?
So with the first distribution of the vaccines, it goes out to the high-risk population. So it would be hospitals and long-term care homes. So all of that has been distributed through our health unit to the appropriate facilities. Next week, Dr. Ahmed and myself will give an update on Monday, but next week we will start getting our shipments that will be distributed to primary care providers. So that will be quite a large distribution, and that our shipment date is Monday. So the uptake right now is primarily with the pharmacies, and they are all receiving the vaccine directly from Ontario Government Pharmacy. And I'm not really sure about the uptake at this time because it is early and not all of them are up and running, but it's early days. But I would anticipate next week will be the real, once we get everything distributed to the primary care providers, we'll start seeing, we'll have more information.
Okay, so there's no idea if there's any shortages or anything like that yet, because we're still kind of getting into it, it sounds like.
Yeah, we anticipate that we'll receive the shipment, our allotment, but our date isn't until Monday, the 19th.
Okay, thank you so much.
Any questions from AM 800?
Dr. Ahmed, is the local health unit investigating a possible third community cluster with these close cases? The reason I'm asking, we heard at the station that a group went to one of the hotspot areas for a party, and then they all came back, and most of them are COVID positive. Is the health unit investigating a third possible cluster?
So what I can tell you, Rob, without compromising any confidentiality, is we always look into any possible situation when we are seeing a group of people coming together or cases that are resulting as a result of specific activities. We start some of those investigations, but then as we get more detail, that investigation stops because there is no ongoing or there is not enough number of cases that we are connecting to find the link. So far, all I can say is at this time, there is no third cluster that we are currently monitoring, but we always look into the possibility when we are seeing some of these connections.
Okay, thank you. I guess just overall, Dr. Ahmed, I know you always talk about there's risk anytime you go out there, and I know it was just asked about the flu shot. For COVID, any idea like when this could end? Because even if there is a vaccine, that doesn't mean this is going to end. Someone can still get COVID if they have the vaccine, just similar to the flu. So I guess my question is, I understand the safety precautions. I've been following them. Everyone has. But at the end of the day, are you worried, and others in the healthcare sector are worried that this could never end if you look at it that way?
Well, all I can say is, when we're talking about these type of pandemic and these type of novel infections, The challenge or the spread happens because our body has never seen that type of virus before or never responded to that type of infection before. And that's why individuals are getting infected quickly and then they are able to pass it on to others. There are a number of things that goes into it that includes that how sick the virus can make an individual. The more sick it make an individual, the likelihood that it is detected very quickly. Because, if people are sick and they're having severe symptoms, they will go immediately to their healthcare provider. With COVID, the challenge is a lot of these cases are mild and they continue to spread before they are even picked up. So in this case, while I can summarize it, I know I don't want to get into too much detail, but what I can say is, as the world is seeing in many of these viruses, and we know even in some cases there are individuals who may recover from it without even knowing that they had the virus. So that the immunity will start to build up in the community, even without the presence of a vaccine. Hopefully, when the vaccine is here, it will just help to expand that immunity. The body will get used to seeing some of the same antigens and will create a response to it. So the overall, just like we said that, the flu is here. Yes, the flu, there is a natural reaction. There's a natural response because it's not entirely a new virus, but yes, it changes rapidly. But overall, then we are able to bring it at a manageable level. And when we are talking about breaking the chain of transmission, that is also a critical concept when we talk about how do we break the chain of transmission. And then if you look at if everyone is susceptible, that means everyone hasn't seen the COVID-19 virus at all. So one case will continue to spread it to everyone because everyone else is susceptible. But then let's say you have people in between who are not susceptible, either through natural immunity, either through previous infection, either through vaccine, then we are breaking that chain of transmission and it will not spread as widely in the community. And what the other concern is in terms of the treatment modalities that are available right now, what are the treatment options? And then hoping that, with all these work and research that's going on, in addition to the vaccine, about the treatments as well. And we should be able to treat those individuals in a timely manner. So in the worst possible scenario, let's say if it never goes away, there will be enough of the individuals who will break the transmission. There will be enough treatment modalities that would be available for people to contain the disease. So I don't see that it's a never-ending thing. I can definitely say, and again, I hate to say it, but it's not going away anytime sooner unless we get the vaccine. Even when you get the vaccine, and as we know, many of the vaccine trials are ongoing. Let's say even by the end of this year, if you have a vaccine, it has to go into the production. It has to go into the distribution. It has to go into the healthcare providers, and then it has to go into the arms of the public. And then we have to look at the uptake of what the vaccine uptake is. There's a lot of misinformation out there. There's a lot of active groups who are already opposing and calling on, and I think that's the worst thing that's happening right now. It's clearly, it's damaging all the work that is being done by public health. People lost their lives, healthcare providers lost their lives fighting at the front line, and it's almost like disrespectful for people to say that, oh, it's just a mild illness, it doesn't kill anyone, we should not let this virus dominate your life. Ask those who lost their loved ones. And it's extremely disrespectful, and I think we need to recognize that yes, it will be there, but there are things that we have always come up with vaccines, with treatments and everything. We will be able to control it, but it can only happen when people recognize what they need to do. There are experts, and all I can tell you, I don't want to talk about myself or talk about anyone else. We have to go through a significant amount of training to be where we are right now. We're not someone who is just scrolling down on the internet, going through the Facebooks, and I'm just putting my expert's comment without having any qualification or credentials. We have to have that, and we should be listening to the experts. We should not be listening to the conspiracy theorists. We should not be listening to people who have any political agenda or a political view, focusing on what the science is and what makes you qualified to provide your scientific expertise and comments on it, and that's how we will get there. But I can assure you that even with the previous pandemics, previous large outbreaks of infectious diseases, we always come through. We always have all those measures in place to keep our community healthy, and this is what we will continue to do. Sorry for the long-winded answer. I just had to say it.
No, I appreciate it, because even if there is a vaccine out there, I think some people are getting confused. If the vaccine is out there, at the end of the day, it's not, the virus is still going to be out there too, because it's almost like the flu shot. You can get the flu shot, but you can still get the flu. So I just want to try to make it clear that even if there is a vaccine, COVID could still be out in the community.
Yes, absolutely. I think that's the key message, and that's why it is important that some of these measures that we are talking about, and we always talk about, again, maybe people are not paying attention before, we always talk about the hand hygiene. We always talk about the importance of staying home when you're sick. We always talk about, caring for your elderly or people with immunocompromised situation. We always talk about that, but maybe people are paying more attention to us right now, which is a good thing. But moving forward, these type of infectious diseases continue to come, and they continue to infect people. And if we follow some of these measures, it always helps to keep us safe. And, we also want to go on with our life. We know how much of an impact social life is, how much of an impact on the mental well-being, the physical activity. Trust me, we are public health. We're not talking about, that you don't do anything. We, in fact, encourage people to be physically active. We talk about mental illness. We talk about how important it is to be socially active. We talk about social connectedness. So we talk about all of those things. It's not that public health doesn't care about all these things. Public health do care about all those things, but it's always the balance of, what are we trying to prevent? And even when we are saying that, the case fatality rate or think about it at a population level. So right now you have, let's say, 1,000 cases, and if your case fatality rate is 3%, that means 1,000 cases, you will lose 30 people. But then you just multiply that with 1,000 to 100,000, suddenly you have 3,000 people who are dying. So it's even with the case fatality or the percentages that people talk about, 1%, 2%, 3%, or however percent, you look at the population perspective, that is still a lot. And if there's any changes happen, then you basically, the community cannot handle it. So there are a lot of complexity when things are interpreted at the population level. And again, no disrespect to some people who are smart, who are trying to make some sense out of it. But trust me that there are a lot of other consideration. There's a lot of if it was that easy, there shouldn't be any specialty as public health, and there shouldn't be any epidemiologists, and there shouldn't be any scientists, public health scientists who are working there. Everyone can just look at the number and then just come up with something, whatever they think. So it goes beyond the number piece as well, and that's what we are trying to do.
Thank you.
Any further questions from Blackburn?
No, thank you.
CBC?
No, thank you.
Amy Hundred?
Just a request for Monday, unless this was mentioned on Wednesday's call, I wasn't on it, but Teresa, can we get an update on the enforcement numbers again, please?
Sure.
Okay,
Thank you.
thank you, everyone. Have a good weekend.
Thank you.